And Stu, you're working on a product that is trying to reach a larger patient population, right? So, I'd be curious to dig into the IVT process and pick your brain on what improvements, to IVT you anticipate will be key to helping us scale up our product. I think we often argue you can make quite a bit of mRNA, right, at a small scale, but what are you finding are some of the challenges of scaling up to a larger percentage, right, or a greater yield of mRNA at a higher quality to reach a larger patient population?
Yeah, good question. Right, so I guess the classic IVT is the batch. You have a bioreactor or a tube even in your lab where you put all the reagents in. It either mixes, it's kind of static. Once they're in there, it goes for however many hours at whatever temperature, and then at the end, that's how much mRNA you get. And that's kind of not exactly the most scalable method.
Okay.
As you need to make, kilograms and kilograms of mRNA, it's hard to scale mixing to that size and also maintain temperature and not get like hot spots in your reactor and things like that.
Okay.
So that's one challenge, is just the physical scale and keeping temperatures and mixing consistent. The other challenge is, especially with larger RNAs, as you increase your yield, we've optimized the heck out of the concentration of every reagent, the magnesium, the polymerase, to make that yield of that batch IVT as high as possible. And at some point, when you reach a high enough yield, the viscosity of the solution it turns into jello, especially with larger RNAs. And so that makes it harder to mix. All the reagents are less mobile in the solution because the viscosity is incredibly high.
Okay.
It's hard to recover out of the reactor even, it starts to precipitate out. And so those are kind of the limitations of the current, gold standard batch IVT.
Okay. Yeah.
And so the way I'd see, the field may be going, and I know people are working on this now, is kind of continuous flow process, where the IVT, you're constantly feeding in new reagents and then pulling out byproducts and your mRNA at the same time. And so the products I've seen, like hollow fibers leverage, where the reaction takes place inside a hollow fiber. And there's ways you can, extract byproducts that way and get your mRNA out that way. But it's still, I think, kind of very early stages for the scale up. And it's a tough question that, we don't have a ton of good answers for yet.
Yeah. Well, I think there are starting to be some, I think, like even just benchtop sort of equipment, right, as well, that is that continuous production, but I'm not sure if it's capable of reaching a very large scale that you need at this point, right? So it's predominantly smaller scale. Christian, what do you have to add, or what are some of the areas for improvements to IVT? Do you think, scale has been something you said that you've struggled with since the beginning, that the field is still struggling with? What do you think are some of the improvements we need to be making? Do you agree with Stu? Running into jello?
I absolutely agree with. I absolutely agree with Stu. I think a natural problem that comes in with the larger scales, apart from all the technical questions we have and physics around that, is simply the costs of these big batches. I think it's known in the field that raw materials are the cost drivers in IVT reactions, and especially if you are thinking of kilos of mRNA in one batch, that batch is few millions of euros or dollars in raw materials. So it kind of puts a natural limit to the scale up currently, I would say, because you don't go to the most efficient version, but you go to the most de-risked version. So everything which de-risks the scale up would be beneficial. And of course, reduced prices would help here significantly to establish large scales and therefore again use more material.